Hello, Mr. Sparrow. My name is Bailey, and I'm a nurse who works in the music therapy department, and I'm here to talk to you about pain management. Is it okay if I talk with you? Very good. Now, I understand you were recently diagnosed with terminal lung cancer. Is that correct? I'm very sorry to hear that. You also decided that you don't want any treatment. Is that correct? Okay. Your oncologist has asked me to speak to you about ways to maintain your pain level once you are discharged home. You have a question? Yes, please ask. You are wondering why you can't continue on the medications you are currently taking to manage your pain? Well, this is something that I wanted to talk to you about. The medications you are currently on are called opioids. These medications are very helpful in decreasing your pain levels and helping you feel relaxed. However, opioids are associated with a lot of side effects, especially if they're used inappropriately or over a long period of time. Some of these side effects include drowsiness, nausea, vomiting, constipation, feeling lethargic or sedated, euphoria, the feeling of being high. And the most concerning problems that could arise from opioid use are respiratory depression, opioid abuse, opioid addiction, and opioid overdose. Hanser 2019. Opioid addiction is a serious thing. It's characterized by powerful, compulsive urge to use opioid drugs even when they're no longer medically required. Opioid addiction is a long lasting chronic disease that can cause major health, social, and economic problems when taking opioids over an extended period of time. The dose needs to be increased to achieve the same effect because the brain builds a drug tolerance to the opioid. Um, so this increase can lead to an overdose, which if not treated quickly leads to unconsciousness and death. Does this make sense to you? Do you have any questions? Okay, can you um, tell me what I've taught you or tell me what you understand about what I just said? Okay, good job. I'm glad you understand. With having an understanding of opioids and problems they can cause, are you interested in learning a different way that you can manage your pain? Awesome. Okay. One way that I want to talk to you about that you can manage your pain is through environmentally based interventions. What does this mean? Well, this refers to you changing your environment into a more relaxing and pleasing atmosphere. For example, you could change the lighting of the room when the sun's coming in by closing the curtains or just dimming the lights, or you could wear some protection over your eyes, like a mask or something. Um, JTC 2018. One environmentally based intervention I would highly recommend is music therapy because music therapy has been associated with statistically significant reduction in opioid and non opioid medication use. You have a question? Yeah, go ahead and ask it. Okay. You want to know what music therapy is? Okay. How can I explain this? Music therapy is a technique that you can use as a patient or anyone by listening to songs or sounds that you find pleasing or relaxing to help you modify your environment and manage your pain or stress. So, music therapy can help you relieve pain and reduce stress and anxiety for yourself, which will result in psychological changes, including improved respiration, lowered blood pressure, improved cardiac output, reduced heart rate, and relaxed muscle tone. Cancer 2019. I have a handout here about music therapy and its benefits. Would you be interested in seeing it? You would? Okay. So here's the handout I created. It explains to you what music therapy is, what type of benefits it has, and statistically why it's important and why I think it can help you out. There you go. You have another question? Yeah, go ahead and ask. Oh, you're wondering if I've seen this technique used in on other patients or if I've seen it work? That's a good question. Yes, I have. Um, I've seen music therapists come into patients' rooms and play music for them. They'll ask the patient the type of songs they prefer, such as like country, rap, Christian, the oldies, any type of music. And depending on what the patient requests, the therapist will sing a song to the style the patient likes. Sometimes they'll have a guitar in there. I found it touching because I saw the change in the patient's overall expression because of the music. One patient I saw was nonverbal, and I could see the happiness on her face as the music was being played. Um, and after the song was over, the therapist would ask her if she wanted another song, and she would nod her head yes, because it was soothing to her, and I could see it in her expression. She really enjoyed the music. Um, and because of that, from what I've witnessed, music therapy is very beneficial to maintaining pain and stress in patients. And if my own experience um, isn't enough for that question, I do want to point out again on this handout, it talks about how a study was conducted um, by Suzanne and Susan, and based on their study, nearly 70% of the people who did music therapy to manage their pain um, had experienced pain relief. Um, so there's that. Does this make sense to you? Do you have any questions? Okay, would you mind explaining to me what music therapy is and how it can be beneficial for you? Okay, good job. I'm glad you understand. Would you be interested in using music therapy as a means of managing your pain? Yes? Awesome. Um, I have my phone with me or radio. Do you have a radio or phone at home? Okay, good. Will you demonstrate and show me how you can find songs on the phone and on the radio that you find soothing? Okay, good job. Do you feel like this is a way that you could or would like to manage your pain at home if you find the right music? Okay, very good. Does everything make sense to you? Do you have any questions, comments, concerns? No? Okay. Well, it was very nice speaking to you, Mr. Sparrow. Have a nice day. So, based on this teaching plan, Mr. Sparrow was taught how to use music therapy. He was taught why he needed to use music therapy, the importance of avoiding using opioids for a long time, um, and stuff like that. So, my target audience are patients who have acute disease or traumatic event that causes pain, or patients who chronically struggle with pain who must perform interventions to manage their pain. These types of patients could be cancer patients, patients who are IV drug users and need high amounts of opioids to relieve pain, patients who have phantom limb pain, etc. There are numerous amounts of people who struggle with pain in different ways and who need ways to relieve or manage their pain once opioids are no longer being considered. Um, so with Mr. Sparrow, how did I know that he learned what I taught him? Well, throughout the teaching presentation, I had Mr. Sparrow teach back to me everything that I taught him. So this showed me if the patient truly understood what I was teaching him or if he needed further education. And I would know if the patient had learned what I taught him if he was able to correctly verbally explain what I had taught him. He also demonstrated how to perform music therapy by choosing songs that were pleasing him. This showed me that he knew how to manage his pain via this technique. And on the teaching PowerPoint, there were 3 questions to know if he was able to attain the information and learn it. Does he have the knowledge to implement the behavior? Yes, he does. He showed me how he can choose songs and play them. Does he want to implement the behavior? Yes, he stated that he was wanting to use music therapy as a way to manage his pain. Did he implement the behavior? Yes, as I said before, he turned the radio on or the phone and he found music that was soothing to him. So the SMART keys for the objective, which I will shortly say to you, would be specific, measurable, attainable, and relevant. So the learning objective for the music therapy teaching is that the patient will be able to verbalize understanding of the music therapy, what it is, how it works, and ways to create or find music sounds for pain management before the end of the teaching plan presentation. So it's specific because the patient will verbalize what music therapy is, how music therapy works, and how to create music to help with pain management. It is measurable because the patient will demonstrate how he can create sounds or play music. It's attainable listening to music or relaxing sounds requires little resources. As we saw, he had a phone and a radio at home, so he has access to music. And it's relevant because music therapy is relevant to him because he wants to use this method to manage his pain. It was shown through studies that pain management can be attained through music therapy, so it is relevant to what he needs. So the goal of the teaching plan is that Mr. Sparrow, is that he would verbalize understanding and demonstrate how it works. So the outcome statement would be that the patient will verbalize understanding of dangers of opioids and the point of music therapy, how to use music therapy, and will also demonstrate how he can manage his pain through this technique. I chose this method for the teaching plan because of how beneficial it is for patients who are in pain. I've witnessed it firsthand and I've experienced it myself. Music soothes me and at times makes me not feel the stress or pain. I've experienced pain I was experiencing before. I think it will decrease opioid dependency because of its impact and because of how accessible the method is to patients. Music is not hard to come by. You hear it in, cliche answer, but like in the elevators. You hear it walking around the mall. You hear music everywhere. It's very easily attainable, which is great for people who want to use music as a means to manage their pain. According to the NIH National Institutes on Drug Abuse, every day more than 130 people in the U.S. die after overdosing on opioids. This misuse of and addiction to opioids is a serious national crisis that affects public health as well as social and economic welfare. Drugs have not been a part of my life. However, in nursing school, one of the biggest impacts I had in the OB segment of the program was how babies were born addicted to drugs their mothers were using. I found this horrifying, not only because the babies had to go through a drug withdrawal that from a choice they didn't do, but a choice that their mother did. But also, I've seen people go through withdrawal, even in the hospital setting, and it's awful for adults. So, how much more how much harder is it for a newborn to go through the same experience? And this is something I feel like impacts our community and our entire nation.